hi, I'm student clinician Garrett. What's your name?
Traven.
Nice to meet you, Traven. Today we'll be doing some neurological reflex tests. This is my neurological reflex hammer. I'm going to use it to do a few tests on different muscles of your body. It feels like this. Is that okay?
Mm-hmm.
Alright. So first we're going to do is the jaw jerk reflex. If I could have you open your mouth and close your eyes for me, please. Good. Jaw jerk is trigeminal nerve with the integrated center in the pons. Then we're going to do the biceps reflex. Flex there, good. And relax. Good. And other side. Relax there again. Good. Biceps is C5, innervated by the musculocutaneous nerve. Then we're going to do brachioradialis. If I could have you just place your hands on your thighs there, good. Brachioradialis is C6, innervated by the radial nerve. Next, we're going to the triceps. Oh, could I have you close your eye for me, please?
Mm-hmm.
And other side. So closing your eyes. Good. The triceps is radial nerve innervated, or C7 innervated by the radial nerve. Then we're going to the patellar. That's fine. Yeah. Relax and close your eyes for me again. Your feet are very purple. Good. Good. Ooh, ooh. Quite an exaggerated response for that one. Patellar reflex is L234, innervated by the femoral nerve, and then we're going to do the Achilles tendon. Good. So just mention that one. Achilles reflex is S1, S2, innervated by the tibial nerve. That's it for the deep tendon reflexes. Next we're going to move on to the visceral, I believe they're called. First one is direct light. So I'm going to be shining this into your eye. Just go ahead and look straight for me, okay? Alright, good. The pupil that I'm shining the light in should constrict. This is using the cranial nerve 2 on this side. Cranial nerve 3 as the efferent nerve, the oculomotor, and the integrating center is in the midbrain. Then we're going to do indirect light reflex test. Same thing, I'm going to shine this light in your eye. Just keep looking straight for me. And we're looking at the opposite eye. It is also constricting. This will be the cranial nerve 2 on the side that the light is going in. And then cranial nerve 3 efferent for the opposite side that I'm shining the light into. And the integrating center is also in the midbrain. Next test, I'm going to have you just look at my pen, and I'm going to bring it to you. Just keep looking at the pen, okay? The accommodation reflex, he's supposed to converge his eyes while I bring it into his face. This is both of the C2s for afferent, or not C2, both of the second cranial nerves for the afferent, both of the third cranial nerves for the efferent, and the integrating center is in the occipital cortex. Next we're going to do the baroreceptor reflex. I'm going to check your pulse here. Alright, close your eyes for me. Anyway, sustain contact on the carotid artery. There is a decrease in the pulse rate of the patient. This is done by the glossopharyngeal nerve, cranial nerve 9. For the efferent nerve is cranial nerve 10, vagus nerve, and the integrating center is in the going to do the oculocardiac reflex. If I could have you close your eyes for me again, I'm going to be contacting your eyelid. Is that okay?
Mm-hmm.
Get the pulse. And then touch the eyelid. Same response, the heart rate should decrease. This is using the trigeminal nerve for afferent, the vagus nerve, cranial nerve 10 for efferent, and the integrating center is also in the medulla. Next we have the ciliospinal test. I'm not sure how I'm supposed to do this. Look at your eye. I'm going to be pinching the bottom of your neck. Is that okay? No, that's alright. With the pain there, your eye is supposed to dilate, and that is using the afferent. Efferent is the sympathetic chain ganglia, and integrating center in the T1, T2 spinal cord. Next, we're going to move on to the superficial reflex is what they're called. So gag reflex we won't actually do, but if I were to do it, I'd have you open your mouth, stick your tongue out. I would put the tongue depressor on the back of the tongue, and a gag response would be elicited. This would be cranial nerve 9 for afferent, cranial nerve 10 for efferent, and integrating center in the medulla, I believe. Then we're going to move on to the forget what that one's called. Interscapular reflex. If I could have you lay on your stomach. I have a Q-tip for this. I'm not exactly sure what I'm supposed to be using. Maybe a cotton swab would be better, but we're going to. I guess you don't have to lay down for this either. I'm not sure if I'm using the wrong thing, but there is no reflex or response when I do this test. You can go ahead and sit back where you were for me. This is afferent T2 to T7 spinal nerves. Integrating center is T2 to T7, and the dorsal scapular nerve is the efferent nerve. Now we're going to do the abdominal portion of that as well. I guess you can lay back for me. I'm going to just bring it towards the umbilicus. Again, no response. It might be because I'm not using the right tool there. If you can go ahead and sit back up for me. That one should be efferent. Afferent is lower T7 to T10 and upper T11 to T12. Integrating center is T7 to T12 spinal cord. Then we're going to move on to the plantar reflex. If I could have you go ahead and scoot back a little for me.
Lord have mercy.
Okay, a little exaggerated response altogether, but the toe did curl a little bit.
Oh my Lord.
Patient does not like this very much. Really not a curling motion going on, but what is supposed to happen is the curling of the toes. This is done by S1, S2, and the nerve is efferent nerve is tibial nerve. Next, we're going to do the Babinski pathological reflex, which is the same as this. So if you can go ahead and go back to where you were. It's the same thing. He's not going to have the... I just don't like that at all. For the Babinski, the big toe would dorsiflex, indicating a upper motor neuron lesion. And then we have the what is ankle clonus test, also another pathological or reflex test. Just quickly dorsiflexing the ankle, nothing happening there. If plantar flexion occurs, then you would have the pathological response. Next, we're going to do the Hoffman. If I can have your hand for me, then. by quickly extending the bottom of the middle finger. If the thumb and index finger contract, that would be an indicator for the positive neurological test. And then Hoffman and what was the other one? Tromer test, just by tapping, see your hand again, the middle 3 digits. And again, no response, but if the fingers were to curl, you would have the pathological reflex. And that's it. Thank you very much for being on patient.
Thank you.